Just leave the arm in this position and work on it. Okay. So this is the large intestine channel. Okay. The Sanjiao channel runs on the middle, and then the small intestine channel runs more on the pinky side. So you can do all three channels in this position. One channel to really pay attention to from the elbow is the large intestine channel. You can actually see it on most people, like it kind of rises up this way. This is where people have like the tennis elbow, and everybody pretty much has a lot of tenderness and knots over here, especially close to the elbow. So you can, just because our society, we use our I don't know, like typing, whatever, we use our extensors, this whole muscle group a lot. So it's good to pay more focused attention to it. So just working down like large intestine channel. You'll probably pluck or go over a lot of pretty distinct fibers as you work the yang side of the arm. If you compare them, you'll notice a difference pretty much right away. Most people on this side of the arm, it's really soft. I mean, for the most part, it's pretty soft. But then when you get to this side, you feel a lot of like fibrous tissue. So large intestine channel basically goes all the way out to the index finger here. On the way, you can hit large intestine 4, which is an important point, between the thumb and basically in this web space between the thumb and the index finger. And then the Sanjiao line, again, it's more on the midline of this yang side of the arm. Okay, I'm just kind of going over it quickly. And then, yeah.
On the inside, it's coming from here and out.
Yeah.
On the yang side, it's from the fingertips and
Yeah.
out.
Yeah.
Okay.
Technically, yeah. The yang side has an opposite flow. It's almost like the yin channels come out, and then the next yang channel brings the flow back in, so it goes back this way. Yeah.
When you're working on it, do you work towards? I'm curious. I'm just.
Yeah, I mean, it's a good question. There are a lot of I think the more traditional approach is to like probably go with the channel. So if you're working the yin channels, you're gonna go out, and then the yang channels, you're gonna go in or something like that. Again, I look at these kinds of things more like on the yang side. Okay, so Sanjiao going down the midline here to the 4th finger, and small intestine going. Small intestine on this side is kind of narrow space because for a lot of the pathway, you're traveling right next to the ulna here, which is you can feel that bone right there. But it basically goes on this narrow space up to the pinky. Okay, when you get to the upper arm, okay, in this position is really ideal for the large intestine channel. If you want to work on the large intestine channel from the shoulder to the arm. This is hard. Most people have a hard time with this, but the lung and the large intestine channel are really right next to each other, especially on the upper arm. So it's easy to get them like mixed up. And for our purposes, it's not all that bad because they are close together. But large intestine 15 basically starts on the deltoid muscle. It's supposed to start off in this depression right here, the top of the shoulder. This is where large intestine 15 is. Okay? And then you go on you continue down the large intestine channel I guess one way to kind of tell if you're more on the large intestine channel is you should be on where the tissue starts getting a little darker. The lung channel, it's on this lateral side of the yin side, but it's still on the pale side of the arm. The large intestine is just a little bit lateral and more on the darker side. You start getting closer to the tricep muscle. Okay. But anyway, you can work down the large intestine channel with the arm in this position. Okay. For the Sanjiao channel, I found it's easier if you bring the arm this way, and you kind of have to support the arm here. Okay. The Sanjiao channel runs basically on the the tricep, the middle of the tricep muscle, right down the middle here. So you can just work on the middle of the tricep muscle here. Going all the way up. And then, I'm sorry, I'm just going to stop there. The small intestine muscle, which is kind of the hardest to get real access to, you can, if the patient is able to, you can just kind of put their hand this way, just like they're, resting, like trying to cover their forehead. Okay. Small intestine channel runs here. Okay. So remember, the heart channel kind of started in the armpit. Small intestine channel goes just lateral to that. So on the on this back edge of the armpit, this tissue here. This is like around small intestine 9-10 area. And you just work your way up the small intestine channel here. Again, as you get closer to the elbow, just be careful with, of hitting like the ulnar nerve. Okay, I know I'm going over this pretty quickly, but those are the 6 channels of the arm. Okay, after I've worked all the channels of the arm, then I like to do like more pulling. So you can pull the arm in all the angles that you worked on the yin channels with. So you can pull the arm in this lower position this way. So pull, and then you can vibrate. I mean, not vibrate, but shake. And then pull. You can also work on the elbow in this position. So you can put your hand in the crease of the elbow joint and then just like fold the elbow and then open again and pull, and just to open up the elbow joint. So you can do that in that position, and if the patient is comfortable with it, you can also take the arm into this position, like pulling just straight out at shoulder level. Same thing, yeah? And just do shaking.
That's nice.
And then same thing, you can fold the elbow joint